For some reason, that music always gets me a little bit more pumpy and ready to play. It's Paula Nutting. It's really great to see you. I'm your musculoskeletal specialist, and today's Ask Me Anything, we are talking about all things joints. And as massage therapists or remedial therapists or body workers or whoever's listening, we so know the balance between when we work with this tissue that we really need to be working at the joints as well. And I couldn't think of a better person to invite to answer questions I've got and any burning questions that you've got other than Petra Fisher, who from what I looked at in her bio and everything, she's been doing a lot of gorgeous, gorgeous stuff for clients and patients who have joint restrictions. So I'm going to ask her to come on board and give us as much juicy topic information as we possibly can. So Petra, when you're there, I'm going to get you to click on board and join me, and let's get this ball rolling.
I'm here. Hi.
Yay. Welcome, Petra. It's really, really, really amazing to see you. So I'm very, very excited. Before we kick off on getting the Petra story and all the things that you can help us with the Petra Fisher movement, I just do a quick shout out to Q Academy. So Q Academy is one of our Queensland-based colleges, and they offer instructions in our remedial massage and our myotherapy. So myotherapist is kind of like a new advanced diploma, and then we're moving it up into hopefully degree form as our higher education keeps going. But the courses are brilliant because they do a lot of stuff with their learning facilitation's really smart. It's fun to learn. It's not boring. So it means that the therapists, that when they learn stuff, they actually really remember how to do it. So if you are listening out there and interested in upskilling yourself from Cert 4 to a diploma, or diploma to remedial, or remedial to myo, then get on board and have a look at what the Q Academy have got to offer. Anyway, that's our wonderful Q guys, and they are so much fun. I worked for them for a while, and I was, when you are playing with racquetballs and throwing minties and redskins and like little things over to a group that can't see you and they're hitting it back, let you know you're learning stuff. Hey, Petra, tell me a little bit about you, because I actually found out about you from one of my group webinars I was talking to in something else in another field. And there was a woman doing all these movements. She was kind of going through and doing this. I'm thinking, what the hell is going on in the background? And she said, I do this, my morning routine, it takes me between 10 and 15 minutes, and I do it every single day. And ever since I started doing it, I have no pain in any part of my body. And this woman is brilliant. Her name is Petra Fisher, and you should talk to her if you want to know anything about helping joints. So that was the biggest plug I've ever heard for someone. So tell me about you. What's the Petra Fisher story?
Yeah, for sure. Well, I mean, my story's been a long one. I didn't start out in the movement body world at all. I came from a corporate background, and I moved into movement because I had so many body issues. I'm pretty sure I'm somewhere on the hypermobility spectrum. And as you no doubt know, that means you tend to get issues. And I also like doing stuff actively. So I basically pounded the crap out of my body for 30 years. And then I was like, this isn't working. And so I became a dedicated visitor to all sorts of therapists. And I mostly was exploring manual therapy. And it wasn't sticking for my body. It just didn't work. It felt great, and then nothing changed. So I ended up in the world of, I guess, corrective movement, which, as you probably also know, has been growing rapidly over the last few years. So I started with rehab Pilates, but moved into a bigger picture take on what movement means in our lives following the work of Katie Bowman, who you may be familiar with as well. Yeah. But if not, she's a biomechanist from America, who was basically saying that what our bodies need is not so much sedentary time plus exercise, but we need to think about all day, everyday movement, and we need to think about how we move.
Hey guys, it's Paula Nutting, your musculoskeletal specialist, and this is that awkward, cheesy kind of part of the video where I ask you a big favor. So if you want great content and lots of information, you can see down here in the little testimonials, there's free manual therapy information. There's really cool stuff on necks, shoulders, backs, hips, wrists, arms, etc., etc. I've got amazing Ask Me Anything podcasts and vodcasts that you can get free access to. if you want to get that great content, can I please ask you 3 things? 1, can you please subscribe to my channel? 2, can you hit the like button? And as they say, just smash the heck out of that like button. The more information that YouTube gets to me, the more I can give content to you. And if you can click on the bell, that will also give you timelines for when I'm actually dropping something into YouTube so that you can access it really quickly. So subscribe, like, and click on the bell. And I'm hoping to get you as much great content as I possibly can. Paula Nutting, your musculoskeletal specialist.
We move not so much big picture, but also small picture. How do we get into all of our little pieces? So that really kind of blew my mind. And I realized that I'd been kind of doing the very intense, followed with nothing, followed with poor movement patterns. And so I started studying with Katie, and I've been studying movement ever since then. And that was almost 9 years ago now. So it's been a while. Yeah, I know. It's funny how time flies, isn't it? But it's been awesome because it's made a huge difference in terms of my body and my health. And it's been something that has been a pleasure and a joy to share with the world, because there's so much that we can do to help ourselves feel better and move differently. And it's not complicated. It's just about a shift in perspective. So I love that the woman who you heard about me from was actually doing CARS. That exercise is called Controlled Articular Rotations. We're going to talk about it, I'm sure. But during an actual lecture, because part of our lever is that we don't have to be sitting still during many of the moments when we are sitting still, and we can sit differently, and we can do little mini exercises, and there's a ton of ways you can add movement into your daily life, which makes a huge difference for your body and doesn't necessarily take away from anything else you're doing. So I think that's important to think about.
Yeah, I agree.
Yeah, I transitioned from corporate world into movement world, and now here I am, basically. That's the short story.
That's a lovely story. So it's interesting. 2 things. 1, did you say you were hyper or hypomobile?
Hyper.
So floppy.
Floppy.
We had this gorgeous teacher. I was listening to a physiotherapist talking in a fitness environment conference, and she was talking about flippies, floppies, and stiffies. And I was like, and I've used it a few times. So she said every child is born a floppy. So we're talking about joint mobility. She said, we're all born floppy. And I remember when I had my babies, I'd like go, yes, you can actually push their feet onto their shins because they're so mobile. And like, it's crazy. And then we get to the stage that you either become a flippy, which is halfway between really, really hypermobile and stiff as an old dog, or you become a stiffy. So you will either be born a floppy, then stay a floppy, which is you, or become a stiffy, or stick between the two. And I'm a bit of a flippy. I can't actually get my finger. I'm not rigid to here, but I can't get it all the way down. Nor do I want to, because
I was going to say you won the lottery. You're good.
Yeah, you do not want to be a floppy, guys, because hypermobility means the ligaments are. That's a bane for any massage therapist. We hate treating people who are hypermobile. So what's the how do I offer people that need to be strong and stop straining ligament or spraining ligaments with movement?
Well, what's so interesting, so the movement work that I teach, I've sort of added a big layer of specific mobility work. And when I talk about mobility, it's tough with the terminology, because when we say hypermobility, it makes you think that mobility is bad. But mobility is great to have if you think about mobility as having control of your movement in a wide range of motion. So that's quite separate from what I think of as flexibility, which is that you can just get into a wide range of motion. And that's your hypermobile people. I'm on the spectrum. I'm kind of like not quite, I'm in the flippy, not the floppy, but not more towards floppy. So what you need is that, the less natural collagen stiffness you have, the more muscular control you need to maintain joint integrity. And that means working on your joints and building control and strength around your joints. And what's so interesting about that is that's very much a similar prescription to what our stiffer people need, which is still connecting to and maintaining control over their joints. But for them, it often means improving range of motion as well. So it's super interesting. The mobility work I teach is great for hypermobility because it's about that awareness and control and strength as well. So it's the same approach for 2 very different purposes.
Okay, yeah, because I spend a lot of time, if I've got someone who's hypomobile, like really my true stiffies, and I'm going out with one of them. He's like, I go, give me neck extension.
Yeah.
No, really? And I'm joint mobilizing the crap out of him. So are you saying that and actually trying to loosen off some of the anterior structures, but are you saying that there's some of the work that we can do in the Fisher movement that will help get a better quality of extension, etc.?
I think so. I think so. My boyfriend is in the stiffy camp as well, and we actually started doing mobility work specifically because he's dislocated his left shoulder 8 times, and he wanted to start surfing in his mid-40s, and we were like, oh, dislocatable shoulder. So we found this school of work because of that. It's called, for your professional designations, it's called Functional Anatomy Seminars is the certifiers. It's a pair of chiropractors outside of in the Toronto area. And they've got actually a manual certification called functional release. And what I teach is the movement side of it. But what they do with the functional release is they get manual therapists to create opportunities for movement, which I think many different manual therapy approaches will do. And then they follow it with the movement work, which is what saves your work. It's what allows you to build that strength and control consciously. And that's why it's such a good marriage. And that's why I love talking to manual practitioners, is because as you know, you're going to get people who come back to you again and again with the same sore spot all of the time. And the way you change that is by helping those people get some movement work into their lives and that control over their own bodies and that awareness of their own bodies. So it becomes something where you can get some progress with your people by having them do some self-care, if you can convince them to do it, which is always the hard thing. But it's not impossible. And so I guess just to step back, the system that I work with is great because it's got kind of a progressive, systematic approach. So what you saw being used, the CARs, the controlled articular rotations, it's a fancy word for joint circles. It's a practice where you do it daily and you take all of your joints through their biggest range of motion with focus and control and awareness. And so what that might look like, I can do, a wrist CAR right here for you. And what I'm attempting to do here is to get my biggest range of motion through the joint that I can control without my fingers getting involved and without my forearm getting involved. So it's an isolation exercise, which if you try doing, many people are going to find that as soon as they start moving their wrist, their forearm's coming right along for the ride. If you balance an imaginary cup of coffee on your forearm right now, can you hold your cup of coffee perfectly still and still make the biggest range of motion possible with your wrist? And you're really trying to connect with the tissues that are working and stretch the tissues on the other side. And it's hard, right? That top. Yeah, wow. Because we never isolate. Absolutely. And it's not that isolation is the be all and the end all, but if you think of yourself as a system with X number of joints, if you can never isolate, then you're always working in the same patterns and you can never get into those kind of little bits and pieces. So when you get your hypermobile person who has a sore shoulder that's super tight all the time, that shoulder is tight to try to get some integrity of movement in the joint. So those muscles go crazy. They're always holding, but they're not usually very strong. And so working on that control and articulation in the range that they actually can achieve is how you can start to let go of some of that necessary tightness because the stabilizers start working better. So it's pretty cool stuff and it's simple. So why I like the CARs and why I teach the CARs so much is that it's a top to bottom, neck to toes, whole body practice that literally does take 10 to 20 minutes a day. I think of it very much like brushing my teeth, but for my joints. And it's a minimum daily dose. I've now moved every single joint in my body, full range of motion, 2 to 5 times. Once you know it, it's very versatile and changeable. And it's very portable. So I can do it on a beach or I can do it in a yoga studio or I can do it in an airport. It doesn't matter. So it's very versatile and delivers a ton of benefits while being fairly simple and doable as well.
Yeah. So that's rotation both ways, like 2 to 5 clockwise. Yeah, which makes sense. And I would have thought that. Well, so if people are out there that are listening, if you've got a question that you want Petra to answer with regards to joint pathologies or I'm sitting there going ding. So a history of again, my partner who is a mad exercise nut was collided with another cyclist, came down, He didn't fracture his shoulder, but did a lot of damage to his shoulder. And since then, golfers or tennis elbow. And I'm saying we have to address what's going on up here, because this is the symptom picture. So could I assume from that because this has lost its stability, he's going to be working at that more distally, etc., to tighten up to try to support that joint? Is that how it works?
Well, I mean, I don't know the exact reason for any given issue in an elbow, but as you know, it's super common. Like when you're working with a tennis elbow issue, you need to think neck, scapula, shoulder, wrist, and probably your elbow is going to get better along the way. But of course, you can do elbow focused work as well. And I would, you want those tendons. Nobody actually knows whether when you're loading tendons, whether what you're changing is nervous system or tendon tissue. It's actually not. The latest I've read is that you don't actually know, but you can help tendon work by loading it correctly. But meanwhile, you need to work on the shoulder and the scapula, so you are loading the elbow correctly instead of always defaulting to using the distal joint. So you're giving your partner great advice, but I don't know what you find, but partners don't always listen to great advice from their partners.
Oh, never. Not ever. Not ever. Exactly.
You can tell him I told him to work on his shoulder.
Yeah, precisely. So he's gone and bought one of those TheraBand rubber daddy. I was like, mate, get your scapular retractors working. Because we always learn, especially not that I'm a chiropractor, but in chiropractic school, axial before appendicular. So get this part of your body performing to allow the others to work a little bit better.
I mean, so I was watching, sense, right?
Yeah. So I was watching. You did. You've got cars, and what's the other one you got going on? There's one that has movement in there as well.
Well, so in the system as a whole, the cars are the glue. They're the maintain your work, save your work, keep your mobility as it is. They're less of they're not the piece that moves the dial along. So when you're talking about your stiff partner, the next piece is the pails and rails, and I think that's where you were going with that. So what the system just starts doing is working on directional isometric training. So if you wanted, here's my shoulder internal rotation. If I wanted to get more shoulder internal rotation, I would use the pails and rails exercise to create that. And that's a directional isometric. So it's very hard to demonstrate easily, but this is I'm trying to get internal. I'm trying to go further that way, and I obviously can't. So the first thing I would do would be directionally trying to escape from the stretch. That's the pails. It means progressive angular isometric loading. So I would stretch for a while, and then I would start trying to escape the stretch. And what that effectively does is it gets your brain to feel like you can create strength in an end range position. And then your brain's like, oh, okay, awesome. And as you may know, the restrictor here isn't my tissue. The restrictor from going into deeper internal rotation is my nervous system not feeling okay there. So what you need to do first is to get your nervous system feeling okay to change. So I'm going to do my pails to try to get feeling safe. And then I'm going to do a rails, which is the opposite. I'm going to try to pull deeper into IR. And ideally and often you're going to get about 10 to 15% more range of motion because you've got that nervous system feeling better. And that's where the manual work can come in too, because what you can do with the manual work is get everything relaxed and feeling better. You can create more range of motion. So once you get that range of motion with your manual work, then you add your pails and rails, and that starts to really open things up and create strength there. And then what you do is you do a little more save your work. So you do some loaded work there, or you really push into your isometric, or you can do some eccentrics. There's a bunch of options. You can even do some more cars in that position, like an axial car especially. So a pure joint rotation rather than a compound joint rotation. And then you get that saving your work. So when you're trying to increase shoulder range of motion, that would be the system. I would warm up with a car, I would add some pails and rails, and then I would do one or two things to really compound the physical changes.
Yeah, that sounds like just a lovely integration of a lot of steps that move people forward. And I agree, the anxiety, which why we hold comes right back to our nervous system. Anyone who sits there and thinks it doesn't, I can just get in with my thumbs, or I can get in with a needle and I can smash that bad boy. They're kidding themselves. And I'm so glad that our profession as a whole is kind of moving away from that sports treatment kind of background. So have you got I know that you've got a couple of courses that you actually are running. So there's Joints for Life, and there's 2.0, and there's also one for feet as well. So that's those courses therapists can do and then integrate into their clinical practice, like as a massage therapist?
I would say so. So Joints for Life is an in-depth overview of only the cars. I don't get into the additional work, but it's a great grounding for the cars because I don't just take you through the cars. I also go through the expanded versions of the cars. So, the cars are your daily warm-up, but you can use them therapeutically. So say you had someone come in with an ankle sprain, you can teach them the cars. They can do a super light ankle car all day long, like high frequency for an acute injury, light tension, no pain. That's going to clear out inflammation. It's going to help heal the tissues. It's a spectacular treatment tool that you can just offer, and it's very easy to offer. So I think that's a nice option for anyone who's working therapeutically with bodies. And it's also, because the cars are so simple, they're also really versatile. So you can think positional changes to change gravitational relationships, and you can think loading, and you can do a ton with them. So Joints for Life is where I start everybody, but it's in detail. So I've got a variety of progressions, so it's very suitable for a professional audience. I teach a lot about feet for a similar reason that I teach a lot about joints, because they're very, very foundational, and most of us abuse them terribly. Not through any fault of our own, but because the world suggests that as a good idea, right? That you go to a shoe store, and what are your options? They're unfortunately not about foot health. They're about style, and that's fine, but not great for your feet. So what that means, and again, I'm sure you've seen it a lot, it means that Western cultures end up with a ton of foot problems, very unfunctional feet, and foot problems travel all the way up the chain because they affect everything, and the compensations related to wearing shoes affect everything. So, your low back person, your knee person, those are the people who you want to get into a minimal footwear as soon as you possibly can, provided that they do it safely and well. So that's where Free Your Feet comes in. And that's a free resource also for a chance to get a taste of my work and a taste of my approach, but it's quite comprehensive as well.
Okay, so could I refer, if I've got a patient of mine who's gone over on an ankle or has repetitive ankle issues, could I refer them to go and do that without, can the layperson do these courses?
They're both designed for lay people, yeah.
Yeah, nice, excellent. So that's a great way, because I'd like to be able to do my stuff and then give them home care that's going to help them progress, and without me going, "Have you done your cars today?" No, that's not my. I've got other exercises that I can do that's nervous system based as well, but neurolymphatic stuff or low load exercise. And I think we need to be, as therapists, combining body work on the table with home care and resistive, or at least isometric or concentric, and then eccentric, whatever. And we don't get taught that much in current college situations. We get a lot of technique-based stuff, but not a lot of conditional training. Is it different you're in Canada? Yeah, the east coast of Canada? Is that where you...
Well, I'm from Canada. Right now I'm in Sri Lanka. So we've been traveling for about 4 years. So we're going to be on your side of the world for a while. Yeah, it's been a while.
Oh, wow. I thought you were just on a little bit of a holiday when you said I'm in Sri Lanka.
No. We started 4 years ago traveling by truck, and we were planning to drive to Patagonia, but like many people, our plans got interrupted by COVID. So we never went further than Mexico. We spent a lot of time in Mexico, and my boyfriend's whole dream is to surf. So I'm sure we'll make it to Australia eventually. But this year it's Bali and Indonesia and Sri Lanka, and then we'll see what happens after that.
Guys, if you want a great lifestyle, that's probably up there on the wish list, to get in the car and travel, or in a truck. I've got a really wonderful practitioner who is in my massage mentorship course, but it's kind of really out there. He's from the state of Washington, or Washington State, as in out there educationally. And he talks a lot about reflex patterns, posturology. And he's just made a comment down here saying every movement of the body has reflex in the feet. So he actually teaches motion palpation to feet, or
cool.
So in everything. Yeah. So, and tell me about tell me more about the foot health, because I think do you get right down into each of the joints, or what are you actually, are we teaching them global movement? I can't imagine it's really easy to roll your toes through.
No, but I think that here again, like you get into like this concept of body blind spots when you're talking movement, and you're going to get your people who are like super stiff and sore through their spine, and usually it's because they can't move their spine segment by segment. They're moving in chunks, and I'm sure you see that all the time. You're going to see that a lot, where what we get all the time is like this hypermobile spot right around T12, because a lot of our movement in the spine comes from there. That happens when we flex our shoulders, because we can't flex our shoulders very well either. So you get this kind of combination. So you got blind spots all over the place. Feet are a particularly common place for those blind spots because they've been put into shoes that don't allow feet to act like feet. There's a ton you can do on feet, and they're a very complex part of the body. But like many things, movement, many people are going to. I'm getting so excited I can't even talk anymore.
Part two. I love it. I love it. This is what it's all about.
Feet are a really easy win. You can do relatively little on feet and get big changes because for many people they are so underused. You don't necessarily need to do a ton of stuff to get a happier foot. So you can go really far and really technical and really detailed, and some people will need that. I have really tricky feet because I've got an injury history as well, and that means that I work a lot on subtle stuff like pronation and supination mechanics that are very specific, but not many people actually have to work on that. So the way that I think about feet, and I just posted an Instagram with kind of all my favorite foot exercises on an Instagram. So if anyone's on IG, they can find me there at Petra Fisher Movement as well. But for most people, you're going to want to start with manual work for sure. And you could do self-manual work with, fingers between toes and rolling on a ball, because your feet are so compromised that just starts bringing blood flow and connection and awareness. The next thing for most people is learn how to lift your toes individually and correctly. So, when you have a bunion forming, which is a very common foot issue, you're going to find that your abductor hallucis is compromised. And so your toe is going to go inwards medially to the foot when you try to lift it instead of out wide. And that's your arch creation muscle. So you really want to get a good big toe lift going, and you want good big toe range of motion, because without good big toe range of motion, you also don't have good walking. So when you walk, and footwork and walking are hand in hand, you need to have probably around 60 degrees of big toe extension in order to walk effectively, because that's what gives you hip extension. You're like, what do I have? Yeah, so that's exactly where we get the pails and rails, because lots of people need pails and rails for their toes. So I've got that in my program because it's an obvious thing to do. So toe lifting, toe mobility, absolutely key. Then you need to start thinking about kind of arch formation. So we're back into the world of floppies and stiffies. A lot of people are going to have a flatter foot, a floppier foot, have a hard time with supination. So in walking, you need to supinate to push off, you need to pronate to shock absorb, and you need to supinate again to push off. So there's a supination, pronation, supination flow. And that's not just the feet, that's traveling all the way up to the hips and even the core and the spine. But we can focus on the feet for it. And so then you're getting right into calf raise land. It's super simple is the great thing about it. If you're doing a calf raise above ground level, you're working more on your supination mechanics. So that's great for your flat foot people. If you're doing an eccentric and going below ground level, you're working more on your pronation mechanics and your shock absorption. So for your high arch people, you're doing you're lowering below the ground level, working on your pronation, and vice versa. So that's a really nice combination. And then you've got to start thinking upstairs. So you know what? I never give myself enough room for these things, but you're going to see this all the time with your people, is that this is how people like to stand. This is the leftover of wearing shoes with heels. This is what shoes with heels and also chairs will do to you. So we need to get people with their hips over their heels, partly for their pelvic floor, which is shortened here, partly for their low back, which is being compressed here, but absolutely also for their feet, because that forward standing is super overloading the forefoot tissues. So if you want a happy foot, you got to think a little bit hips, hamstrings, psoas. So that's all in that free foot course, because those are just so essential. If you get those down, 80% of people are going to be better.
Yeah, that's fantastic. That is fantastic. I was digging around on some of your Instagram. Yeah, I love a little bit of background time to play, and I was noticing that you were showing and thank you. I was noticing that you're showing people how to actually go from sit to stand, and the capacity of being able to do that, because people are so quad dominant, like they thrust themselves forward. I teach how to sit to stand using neurolymphatic stuff, but I loved that you said throw your knees back, like try to think about that, because that's a good cue for people. And is that the kind of stuff that, like, do you talk on cues, joint cues, or that just happened to be that one that I was like going, oh wow, that's a good joint cue? Knees into extension for me was like, that's a lovely way to say it,
Oh
versus
gosh,
push
I'm
your
not
hips
sure.
forward. Like
Oh yeah.
you know, like people go like that, which is
Yeah.
like, no, like they say,
Just
oh,
no.
I'm
Just
using my
no.
bum muscle, I'm using my butt, like, see,
Yeah.
it's like, no,
Yeah.
it's not.
Yeah.
You actually
Yeah.
got to find the pathway, that's the movement pathway. So like you said, ball, heel, and elevating in that, not that.
Yeah. I think as you say, like so much of our stuff is kind of pushing our bodies forward. We're lifting our rib cage with that like poor T12 junction. We're pushing our knees forward to get up. I don't think those are necessarily bad movements. I just think that they're overused movements. There's a dose makes the poison issue happening in our movement patterns. And because of heeled shoes and because of chairs and because of whatever, we tend to hang out in that front body a lot. So when I tend to teach it more with squatting mechanics, actually, as sort of a vertical shin squat or a vertical shin movement. But it helps people like actually start to absorb. I don't know, that's not the right word. Start to move better and become more aware of the back of their body. What you want to give people is more options, right? And especially once it comes to walking and movement. And, I sit on the floor as a daily movement practice because it's a no-brainer when we're talking about bringing exercise out of the studio. If you're spending 8 hours a day in a chair, you're missing opportunities to get down to the floor and up from the floor, and the hip movement variety. And it's such a no-brainer because it's a no extra time way, and you can't do it in some contexts, obviously, but you can in a lot. And so I try to open up the door on that one. So floor sitting to me is just like, it's like wearing minimal shoes. It's just such an easy way to get more and better movement in your life. And like, why not use it as a chance to get into your hips and hamstrings more? And as you start to use them more, then standing becomes better, and then suddenly your feet become better. So it all kind of wraps together in a nice way once you start the momentum going. And I think the hard part about this work, and probably what you find as well, is that it's so big. Like, there's so much you can do. People get overwhelmed with it all the time. So I really try with my work to break it down a little bit, but it's tough because there is a lot to think about.
Yeah, and that's exactly right. Beach walking on soft surfaces, good, bad, indifferent, no different?
That's a good question. I mean, I think it's going to be, and it depends. I think overall it's great. Like, why wouldn't it be great? It's nice to expose our bodies to variety. I think variety is almost always a good idea. For some bodies, it's going to be too much. So, like, you want to always listen to your body and ask yourself if it feels right. But what our bodies are great at is adapting to things. And so I mean, I don't see why you wouldn't want to walk barefoot on the beach as much as possible. I will say, again, like, one of the reasons I teach a lot about feet is because I personally have had a lot of foot issues. I've spent 4 years barefoot, mostly on surf beaches. I have not noticed a miraculous transformation of perfection in my feet like that. So that's the other thing. So you got to think about a few things. You've got to think about environment change. So that's your sitting habits, that's your shoe habits. You've got to think about maybe corrective exercises, which are the things that help you build strength, but you also want to think about patterning. So I think that, people will benefit the most from doing exercises that helps you add new and different patterns. So if your foot is stuck in a supination pattern and you don't do work to change that, then even creating strength and being in better shoes is not necessarily going to give you the results you want, because you have to give your brain and body access to more options as you go along as well. So those are the, that extra 20%. I'm that 20% where, there's a bunch more stuff where I've got to figure it out because it's tricky. but that's okay.
Yeah.
You know, what else are you going to do with your time?
I know, exactly. I've got plenty of time, so just walk. Talking about time, what I'm going to do is I'm just going to throw into a small little ad clip for Q Academy, just to give them another plug, because they are honestly, as a teacher professionally, they were awesome to work with, and for therapists around Queensland, and hopefully they were getting up into the North Queensland space soon. We're going to throw into Q Academy, and they can give us a little bit more juice on what you can get from them. So we'll be back in a minute.
My name is Jade Afu. I studied Cert 4 massage in 2014 and then went on to remedial in 2015. I was working in ASICs. I was retail, Lorna Jane. The real reason why I went and studied was my daughter was, she's been quite sick for about 7 years on and off. She's had a couple of chronic conditions. So I found it hard working in a job and having to leave because my children are sick, or I've got to go to hospital, or there's just so many things going on. For me, I needed another option. I've been set up for about 8 years now, working from home. Having a home business has been like such a blessing to my life. I don't think I could have done what I've done somewhere else, just with my own circumstances. My life's very busy. I've got 3 kids. And this year has been a little bit different again, because now I've got 3 kids playing sports every afternoon. So I do try, if I can, work in between school hours. I feel like you can make it work to your advantage. So you can either work as hard as you want and be stressed and all the things, or you can make it flexible.
Which is very cool. And are you doing some feet work right now? Is that what I'm watching? I know. I was just kind of
you caught me.
I love that. I love that, getting into between the toes and giving them a. Yeah, I'd forgotten about that
Isn't
stuff.
it nice?
You do
You
forget.
can give yourself like a little like toe splits. I know you forget all the good stuff, right? But like, it's just, that's one of the nice things about, you know, your journey, though, is that you can remember them again later. And so it's really good. All right, I'll stop now. It's probably really distracting. Yay!
No, so everybody get into your toes. And like, I know that I try to wear no shoes for as much as I possibly can. And I saw that the origination of a high heel shoe was for butchers to keep out of blood. That was the original high shoe was designed for men in butcher shops.
I have a feeling it might be one of those things where there were a few origins, because I know that I've heard that it was like one of the French royalties, one of the French kings was short, and so he got a heeled shoe going, and then it got fashionable. But I mean, who knows, right? Humans always.
always and it could, and you know, in France they wouldn't have, maybe like butchers in there, and I'm sure they probably wore high, like although in Asia, in the Chinese, like they have the high whole shoe, not a heel lift.
Yeah, it's really quite fascinating. Of course, there's a lot of reasons for shoes, and one of the categories where it's hard to find a minimal style shoe or a natural shoe is sports shoes, especially cleats. So if you have a child who's playing soccer, it's very hard to find a wide toe box cleat because they just don't exist. And there you have a very functional reason for needing a tight shoe that's connected to the foot so that they can actually do their thing. And it's actually really interesting. If you see some of the best American basketball players, some of them have truly, truly distressing looking feet, but they're very functional because those guys are playing amazing basketball. Like, who knows about the long-term outcomes, but it's pretty interesting. You know, that humans are just so incredibly adaptable and amazing, and we can do all kinds of things, even in the face of stuff that doesn't look like it should work.
Well, look at ballerinas and the toe point shoes. That, like, those feet look like claws. And then, the foot binding in Japan. So like there's been ways we've screwed feet up. So let's go to the top end. I was doing a morning webinar with a Zoom link with some good therapists, and one of the girls from Ireland was saying that every second person she's seeing is head forward right now. All the SCMs are firing up, and again the anxiety is up over there because it's getting cold. We've got the flu season ripping through. They've got the next strain of the you know what that we won't be speaking of. And people's anxiety levels are going through the roof. So they're automatically in that. Is there lovely, can we be unpetrified? I always think petrified is a great term because it's like petrified timber. We want to be.
I know it's not the best marketing word. We want to be unpetrified. It's true. We want to be supple and relaxed. Yeah.
Is there ways that have you got advice that we can offer therapists who can offer their patients and clients for necks?
I mean, I'm a terrible neck forward thruster myself. I have a tongue tie history. And so that's something that, isn't talked about that much, but it's an interesting thing to consider. A lot of people who are coming in with TMJ or poor sleep or airway issues because there's a few big issues with that. But number one is that tongue ties are actually quite widespread and prevent you from swallowing well. And if you don't swallow well, you have a hard time putting your tongue where it's supposed to be, and then you don't breathe well, and then you get airway issues. So tongue ties are a thing that's not being talked about enough. And I don't work with them professionally, but there's a whole group of oromyofunctional therapists. That's a whole therapy area working on how to get the muscles of the face and jaw working better, especially before and after a release. There's also airway in general. Because we eat such soft foods, we're getting really collapsed in faces. And so thumb sucking, mouth breathing as a child, a lack of breastfeeding. So that's another movement thing, like in my world, where you're like, small movements matter. And especially as you're growing up, you really want to get good face development. And one of the reasons my face looks the way that it does is because I had such a bad tongue tie. So I have very little mid-face development as I grew up. And you're going to see that happen with chins as well. So where you get a recessed chin, it's often an airway thing. So as a therapist, as somebody who's seeing people come in, you're going to for sure see people with those issues come into you, and they're going to be your TMJ people and your sleep apnea people. There's a lot of resources out there that are about that, and those are going to be tending like this because that's how you can breathe when you're dealing with those issues. So that's one of the reasons I have a lot of that kind of neck and front body tightness. So that's it's a bit of a side note, but it's interesting.
It's really interesting because I had never thought about people actually getting into that space to allow for tracheal access. And we spent a lot of time going, get that head back. But unless we've addressed that thing, the elephant in the room. Wow.
You got to breathe. Breathing's going to trump everything.
Yeah.
But of course, if you're breathing through your mouth, then you're like in a higher sympathetic activation system. So, you're right, are back in that anxiety system. So it's really something to look into. James Nestor's book, Breath, is a really good resource. So you probably know about that already, but I would start most people on that one. And there's a ton of airway stuff, and I'm happy to give you names of people to talk to or learn about that if that's something that you're interested in. But the dentists are just kind of starting to figure it out.
Yeah, so I'm just like, write that down if you're listening, James Nestor, and the book is called Breath. A friend of mine read it and said, like, one of the big things is taping the mouth shut at night. Anxiety.
But you know what? So
very rarely breathe.
Oh, well, okay. So you know what? You don't necessarily want to start taping by planning to tape overnight. But what actually happens is fascinating. Our noses start to clear themselves out when we breathe through them more often. It's crazy. So it's like this sort of chicken and egg thing. So there's quite a few breathing practices that can help you with that. Buteyko breathing, I think, has some specific kind of nasal transition options. And I do tape at night and I love it. But if you're anxious about taping at night, start taping in the day. Go for like a run with some, it's just, I like the micropore tape from NextCare. Yeah. You don't want to use like a tape that's too intense, but give yourself some time to get used to it. You will look a little bit weird, but I don't know. If you're okay with that, then it's a really good idea.
I'm thinking The Matrix. Remember when he's trying to talk and his mouth kind of gets stuck together? Like he was talking to Mr. Smith. Yeah,
totally.
I think the more you smile and the more you can actually do smiling and laughing and jaw movement in itself, you're actually helping just the general glossopharyngeal, the neural pathways as well, those cranial nerves. So we have to be, we can work at that end as well, at the nervous system. Mm-hmm. But for neck ranges in general, like neck extensions and flexions, is there a car for neck that you do specifically?
Of course, there's cars for everything. So, I mean, the neck car, I'll go sideways because I think it's probably a little bit better sideways. But the neck car is your attempted segmental movement in all of your neck vertebrae. So the cars work. So this would be an axial car. So just flexion and extension, where you're really trying to get your segmented movement and trying to keep everything else out of it. And then, of course, you could just do a pure rotation. But the full neck car is a segment down, a rotate, an extend, and around. And what you're going to see is that most people, when they started, are going to tend to get a lot of associated shoulder movement. They're going to lift a scapula. You're going to see a lot of this kind of stuff going on. And you're also going to see a lot of head forward. So again, like, I mean, you want to be thinking like that's that ramping back opportunity. So really trying to like fold segmentally, and you're going to see your restrictions. So one place where the manual and the movement work really well together is if I was to laterally shift my head and feel a sense of pinching or constriction on the side of my neck, that's where you're getting a lack of joint space. And that's the thing the cars won't really help you with, because your joints are slamming into each other. So there, a little bit of assistance for manual work is really, really helpful, helping to distract, helping to create space. And then you can go back into your car or a car variation to start creating some more opportunities. You can absolutely do pails and rails and isometrics for your neck too. So we sort of skipped over it, but you know, when I was demonstrating the pails and rails for the arm, you can also do isometrics in the same way. So an isometric would be the pail and rail without the stretch in a mid-range, and this is your hypermobile exercise. So I'm in my mid-range here. I'm creating force going up. I'm creating force going down. I'm strengthening and increasing awareness within my range of motion. And of course, why would you stretch at end range for someone who's super hypermobile? You wouldn't, but you can definitely isometric through the range. You get strengthening happening for about 15 degrees of range the whole way. It's not the most fun exercise, but it's incredibly effective for someone who's trying to create some awareness. So now we go back to our neck. Neck isometrics are incredibly analgesic as well. So that's one of the great things about your isometrics. If I wanted to work on my neck and within its range of motion, I'm going to look like a weirdo, but I'm going to do it. It's really nice to use a yoga block. And so I can rotate into my yoga block here, and I'm creating force as though I'm turning my head. This is a wonderful option. And of course, once you learn your sticky spots, you find your sticky spot, and then you can just sort of push into and away from your sticky spot. It's not rocket science. It's awesome. And once it takes a while to figure out the system, but once you learn the system, you have a ton of tools that you can apply for many, many purposes.
Yeah, wonderful. The language that we would use on those pushing is just a muscle energy technique. So just applying a little bit of compression into that range, and then you've got that post contraction relaxation phase. So once you've pressed, it then gives time up to 90 seconds for that whole area to relax itself, and pressing into here is naturally going to release the antagonist group anyway. So for therapists who are going, what's that's the language that we would be using, that is what you would probably be more familiar with. And I love that you're kind of going through ranges and going, okay, well, that's my stick point, I can feel it here, so I'm going to apply exactly across the axis, right? Like you're just finding the axis of the stick and then applying at what, 15%? Is that what you said? It's like it's not a heavy press for the neck. Like it'd be strong.
For the neck, I tend to go lighter. Yeah. I mean, it's going to depend a little bit, but for the neck, I mean, why would you ever you're never going to slam into your neck. As time goes on, you can create more strength and more control. Then sure, go a little higher, but I would work gently on the neck. With the shoulder, with the deep shoulder capsule stuff, I would also start lower, like maybe 20 to 40% on, once you're in that deep IR, because it's it doesn't get used that way. But at a certain point, yes, you're working to 80 to 100% of your safest, greatest effort, because that's where you're getting the changes. So the whole idea is that, you are loading, you're trying to load at end range. It's hard. It's your 80% is still not going to be super impressive, probably. Maybe it will be.
I'm going to use a dirty word here. Frozen shoulder.
No, not frozen shoulder. Such a hard one.
I always say no when people ask about frozen shoulders, because it's so complex. Is there any Like if someone's starting to get, and we know it's pathology. It's going to take around about 11 months. It goes freezing, frozen, thawing, like it's its own beast anyway. Is there ways that we could support someone who's in the middle of that plight? Like just to maybe analgesic, as you said, like to get the movement, who knows? But I love the thought that you can do analgesics.
Isometrics help you feel better. It's really weird, but it's cool. It's really awesome. And I think it's partly because they're very safe, right? Like, so I would say, like, why not do isometrics? You can do isometrics like at your 90 degrees, but you can do them at your like whatever degrees as well. And I like to do it with a bent elbow, but you don't need a bent elbow. It takes time to figure it out because you've got to get used to this idea of moving in all these ranges. And that's, again, you do the cars every day, partly because you're learning an alphabet of options as you do them. So I'm finding my frozen shoulder people are really liking cars. And so here's another manual cars technique is you've got a passive car, right? You can be rotating your person passively through their range. Yeah. And so passive cars can be really nice for frozen shoulder. In general, I'm not a big fan of pushing people into pain. So you want to find the edge of their pain-free movement. And then you can definitely apply isometrics there. And there you're looking at maybe some neck and scapula stuff around the area. And maybe some subscap work followed by maybe some passive cars, maybe some active cars is what I'm hearing seems nice for people. So that's not a 100%, but that's what I would be thinking about exploring.
Yeah. And it's all about just helping them through that journey, like giving them safety as clinicians and go, look, you know what, whatever I do, it's probably not going to make that much difference to the length of time, but we can certainly make you feel a damn lot better and feel more comfortable through that process. And a lot of people actually forget that that's part of our role. And we have the luxury of an hour in the clinic if you want that length of time. We're not mediated by the regulations and registrations that some of the other manual allied health get caught in. So make people feel safe. Give them that I feel really good in the clinic with you, or I feel really good in the space where you would work with groups of people, I guess, as well as one-to-one.
I work almost exclusively. Well, it's hard for me to work one-on-one because of traveling. So yes, I absolutely work with groups of people. The FRC work, so this whole mobility thing, they've got a group class version called Kinstretch, and Kinstretch is where you can go and kind of experience what it's like in a group class. Less useful for targeting your particular thing, but great for learning all of the techniques. And so I think Kinstretch is sort of one of those things you can take it and then you'll probably hate it, but you might love it at the same time because it's very intense. But I love it. Like, we do it as often as we can manage it because it's you feel like you've worked after a Kinstretch class, which is nice.
Yeah, I think I've heard of it.
Yeah, you're so right that, a huge part of all of this, whether it's your role as a manual therapist or whether it's movement, is that sense of confidence and capacity and safety cannot be overstated of how important it is. It's absolutely key. And to be able to go to another human and get that sense of release and relaxation that is so missing from our world right now, you're providing an amazing service. Absolutely amazing.
Yeah, no, and it's I always kind of feel blessed that people are prepared to come and see us and trust us. And like, if you think about how many professions, us and hairdressers and beauty therapists, there's very little out there that are allowed to touch. Personal trainers, they kind of like point to an area, like, I want you to engage here. Like there's not that connection, like it's really, we have graciously accepting the fact that people are allowing us to touch them. So it is beautiful. You talked about earlier from Toronto, functional anatomy school
seminars. Functional anatomy seminars. So that's where all of this stuff lives. So if you were to want to add it to your modalities, you would start with the functional range conditioning certification, which is their base sort of movement modality. And then you would take the functional release certification. So they've got 3 of them. There's a general and a spine and a something else. But it's great work. The therapists I work with, I work almost exclusively with FR trained therapists now because it works so well with what I mean, literally is hand in glove with it. Yeah. And it just makes a lot of sense to me. But of course, I don't think we like to call things and split and join. And what's nice about FRC is it's a system. It's very laid out for you, but it's like, you're like saying exactly what I'm saying. You're like, oh yeah, go on the axis and do this like thing and then release. It's like, it's not different stuff. What it is systematized. It's systematized and it's all in one place, and it gives you a nice exercise option to share. So I think that it's useful from that point of view, but I don't think it's exclusive to them, and nor would they say it was exclusive to them.
Yeah, it sounds a bit like Les Mills, like a prescriptive. Not that they sound like Les Mills. Do you know Les Mills? Have you heard of Les Mills?
I don't know Les Mills. No.
Okay, so Les Mills, Australia and New Zealand. I think Les Mills comes from New Zealand originally, and he came in like I love you with all places, but they came in like a freaking plague, and they designed body attack and body pump and body step and body something or other. So that like cycling. So it's the therapist. My background is after nursing, I did taught aerobics full time for 5 years, like 25 classes a week. So you imagine what my joints look like. And we actually had to write down and work out our grapevines and easy walks and 3-knee repeaters. Les Mills is completely prescriptive, so anyone can come in, do the certificate, and then they can teach, providing, like, I've got track number 7, so this is what we're going to do, which is probably safer because it just means that there's a continuality in it. But it took some of the choreography, or took all the choreography out. So people who like to go, oh, where are you feeling that? Oh, okay, it's feeling it there. I'm just going to get you to do a MET into that rotation. It takes away some of that brain power. And I like the fact that we as therapists should be using reflective practice and like looking at progressive prognoses or what hypothesis we're going to be looking at to treat. And we don't want to lose that skill. So I love what you're doing. I super love what you're doing.
But it's nice because it's systematic and there's a framework, but then within it you can be very, very creative. So I think that it's a nice place to be, because you've got some guidelines, but you don't have to be tied in by anything. I just saw there's a comment in the comments, and I know you said that you wanted to me not to talk about them, but I just wanted to say, because you were asking about forward head and upper body tension, and I wanted to circle us all the way back to feet, because one of the things that you don't think about when you're talking about that upper body tension is, again, how we're walking and what our feet and calves are doing. So, to really boil down walking mechanics, the way that we tend to be walking, because we're so forward dominated, is that we'll lift up at the hip flexors and we'll push off and we'll fall and lean forward. And so what you're getting is this constant mini whiplash, just 100% mini whiplash. And so you've got another propulsion possibility where you're standing on your one leg, that one leg is reaching behind you, you're maybe making a slightly shorter step, but you're much more vertical. And so one of the ways that you can start addressing your neck issues, your shoulder tightness, and your spinal, your hyperkyphosis, is all the way back down to happier feet and longer calves and a less forward pushing kind of a thing. So I just wanted to bring that up because you were asking about decreasing tension here. I think that's huge, and it's not talked about at all, because we're like, oh, well, fix the neck. Sure, fix the neck, but like, let's talk about the calves too. Yeah.
And how many people have got tight calves that we see? Like,
Everybody,
and tight hamstrings and tight calves. Hamstrings are like, I know the hamstrings are tight because they're trying to stabilize a pelvis that's lost its mojo. It's lost its capacity to stay strong. So tell me, the first muscle that's going to stop any more anteriorization is the one that's attached to the ischial tuberosities. So your hamstrings are going to try to support the pelvis, because we don't want to lose we need to breathe, we need a heart, we need lungs, we need reproductive organs. So the body, the nervous system is going to protect the organs way before it's going to protect muscles, way before. And anyone who doesn't,
yeah, exactly. And so it's like, you got to coax the body back to this place where it doesn't have to rely on those compensating patterns. So that's why it doesn't make a ton of sense just to press out tightness, because the tightness is there for a really good reason. And so if you think a little bit more holistically, then you can use your beautiful nervous system and like physical changes to create a movement change so that you can be a little bit further back more safely and create some strength there. And then maybe you add some sitting on the floor so that you're not asking your body to tighten again by being in a chair. And, you just go bit by bit by bit. But what's really cool is that, you see wins along the way. You don't have to get to a certain point to be better. You start to see bits of better all along the pathway, which is really cool.
I love it. I love it. And on that amazing note, I'm going to let you run away, probably back to the beach to have a bit of a swim or eat something healthy.
Carbs. I didn't do my carbs yet today.
Well, I'm going to get in and play with my feet because that to me is, I love it. I love it. Thank you so much for your time and giving of your gorgeous information. Everybody, I want you to jump on and have a look at what Petra's got to offer. It's down there in the ticker down there. Visit her Fisher Movement on Instagram. Go to fishermovement.com for the information on a couple of the courses that she's got. I mean, some are free and some you can easily get more information about how she can help you along your journey and how you can help. Like I always just go, my parents, like help your elderly, help those people that need this work, and then get into like watch kids move because that's what they do. They know how to do it first before we screw them up. But Petra, thank you so much for everything. Yeah, Joints for Life 2.0. That's the one if you want to get in, want joints that last. Join Petra's now upgraded program. So there you go. It's in the links down there. Yeah, and Han says I have her program open to explore. So he'll be dancing all over that space. Petra, thank you so much. Right. It's been absolute pleasure. Thanks everyone for joining. These will be in Petra's website, in my website, and in the Massage Mentoring group. So we'll see you guys next month. I've got Nancy Shaw, she was one of the people who worked with Janet Travell. So that's our trigger point guru. So looking super forward to that. Put that in your diaries. That's going to be the 16th for us in Australia, the 15th for everybody else on the Northern Hemisphere. Nancy Shaw, that's of December, of course, and look for the information on Facebook. So thank you, Petra. Thanks, everybody, and we'll see you guys later.
Thank you.